Assalamu alaikum. Hello everyone, it's me again, and today I'm going to talk to you about polycystic ovary syndrome or PCOS. We're going to know the definition, etiology, clinical presentation, comorbidities, diagnosis, and management. What is a polycystic ovary syndrome? It's a combination of three main aspects: anovulation, excess androgen activity, and polycystic ovaries. It's a common endocrine system disorder among women of reproductive age, representing about 10%. So what happens in a normal ovary? The hypothalamus secretes a gonadotropin-releasing hormone which affects the anterior pituitary to release FSH and LH. They're going to work on the ovaries. This is an inner view of an ovary. Those circles are called follicles. We're going to take one of those follicles out to see how it looks like under a microscope. We have the oocytes, an inner layer called granulosa layer, and an outer layer called theca layer. The LH is going to work on theca layer to produce androgen, and we're talking about females, so the androgen must be transformed into something else, and this is done by the FSH. The FSH is going to work on the inner layer, granulosa, to help to transform androgen into estradiol, and the estradiol helps in the ovulation and the egg to come out to be fertilized with the sperm. In the polycystic ovary syndrome, we have a problem in LH secretion. There is an extra LH secretion. It's going to work on theca cells and going to produce excess androgen. You might think, okay, so extra androgen is going to produce extra estradiol. We're going to have more ovulation, maybe more eggs. No, this is not how it works. The androgen has two bad effects. It causes hirsutism and produces something called estrogen. So is estrogen good? No, it's not good. It's going to inhibit the FSH hormone, so the androgen is not going to be transformed into estradiol. You're not going to have ovulation. The follicles will be arrested at a certain point of their maturation. So symptoms and signs of polycystic ovary syndrome: you can have acne, hirsutism, falling of hair, skin pigmentations, infertility or menstrual irregularities. Most women come to the clinic complaining of menstrual irregularities and obesity. So comorbidities: if you're having PCOS, you're very likely to be having other diseases, most commonly diabetes, cardiovascular diseases, endometrial cancer, and sleep apnea. And by the way, sleep apnea, if you're having PCOS and start snoring, you should see your doctor, because this is the first sign of a sleeping apnea, and this is very dangerous. Type 1 diabetes: if you are a type 1 diabetes patient, you're taking exogenous insulin therapy, which is absorbed directly into the systemic circulation. It's going to cause extra stress on your ovaries. Let's agree on something: extra insulin equals extra stress on your ovary. A study showed that 75% of women with type 1 diabetes on intensive insulin therapy, they had either PCOS or at least polycystic ovarian morphology, in contrast to just 33% of women with type 1 diabetes on conservative conventional therapy. Type 2 diabetes: it's more common to have type 2 diabetes than type 1 with PCOS, because there's something in common between both, which is obesity. If you're having obesity, you're gonna have insulin resistance, and your body's gonna compensate. It's gonna secrete more insulin. You're gonna have hyperinsulinemia. It's gonna stress your ovaries, as we agreed before. About 38 to 88% of women with PCOS are overweight or obese. So how are we gonna diagnose PCOS? First, history taking, and we talked about signs and symptoms before. Second, gynecological ultrasound. We have specific criteria for establishing PCOS diagnosis. They are having 10 or more cysts. Each one is from 2 to 8. If you count those cysts, you're gonna find them more than 10. Each one is from 2 to 8 millimeter in diameter. They are peripherally arranged, as in a string of pearls appearance. This is a normal ovary. If you count those follicles, you're gonna find them less than 10. They are larger than those cysts, and they don't give the specific string of pearls appearance. An MRI is used for obese patients. Laparoscopic examination shows an enlarged ovary and polycystic ovary not having smooth surface like a normal ovary. And serum blood levels of androgen, ratio of LH to FSH is suggestive but not diagnostic of PCOS. Management: lifestyle changes and medications and surgery are strategies for management of PCOS. In lifestyle, my advice for you is to be active. About 30, as we said before, up to 80% of women with PCOS are obese, and just modest weight loss of just 5% can significantly improve many of the clinical and biochemical features of PCOS. And myself, I've seen videos on YouTube about women getting cured by only reducing their weight and following a healthy lifestyle. So you're gonna have to change your lifestyle in eating. You're gonna have to eat more vegetable and fruits, whole grain bread and whole grain pasta, and just keep yourself away from junk food, any kind of junk food. And of course, exercise is important. Metabolic derangements in anovulation, hirsutism, and menstrual irregularities can be treated medically. We have contraceptive pills. They suppress the ovarian androgen production, and metformin. A long-term study suggested that metformin continued to improve the metabolic profile of women with PCOS over a 36-month treatment course. Clomiphene citrate. It's a first-line therapy to stimulate ovulation when fertility is desired, as it increases FSH, so it helps the transformation of androgen into estradiol and helps ovulation, as we said before. And spironolactone, it blocks the effects of androgen on skin, blocks the androgen receptors, so it prevents hirsutism. Surgery, we have drilling and removal of the ovary. Drilling is helping to empty your ovary, as we see in here, by making holes in the ovary by this device, laparoscope. And another strategy is removal of your ovary. Your doctor is going to decide which strategy you're going to follow. Some women are just treated by lifestyle changes, other women by medication, others they have to do surgery, so you have to consult your doctor. Last thing I want to say is PCOS stands for power control over situations. You're not alone. There are 10% of women suffering the same disease. You just have to take care of yourself, eat well, stay away from junk food, and feel free to talk with someone close to you and visit the doctor. Don't miss appointments, don't lose hope, and thank you for listening.